Hi, I'm John Crowley again with McLean County Orthopedics Physical Therapy, and today we're going to talk to you about some postural dysfunction and some symptoms that might present with that, and then some potential ways to start to treat that. Now remember, none of our videos are intended to diagnose any significant musculoskeletal issues. They're just there for your reference. If you feel like you're having significant issues, or if these videos are not helping, by all means contact your healthcare provider at McLean County Orthopedics Physical Therapy. So we've got Lauren here today, and right now Lauren's actually sitting in some pretty good posture. So we're going to have Lauren go ahead and show us some really dysfunctional posture that we may see in the office or at home nowadays with people working at home. So we tend to be slouched through the upper back, head and neck tend to be protruded forward, and then our eyes are level to the horizon or the screen or whatever we're working on in front of us. Okay? So here we go. Go ahead and sit back up nice and tall, Lauren. Give you a little analogy of what that's like. I've got this kind of big heavy club right here, and I'm going to rest my forearm on the back of Lauren's chair. In this position, there's not a lot of pressure on my wrist or my forearm. I'm not working very hard to keep this up and balanced. And this club weighs about 5 pounds. So as she slouches, go ahead and start to slouch. It's a lot like taking this club forward. That pressure of that leaning forward puts a lot more pressure in my wrist and my forearm to have to try to control that. So we can take that and say that the farther that the head actually starts to move forward, the more pressure it's actually increasing on the back side in the cervical spine. Okay? There's a couple other issues that might come up with that. When she gets that slouched position and we keep the eyes level, we're actually increasing a lot of compression in the upper cervical spine. Some things that you might see with that are some headaches, whether they be coming up into the top of the head, the front of the forehead, or even just back here like a tension style headache. A lot of increased tension in the muscle tissue back through here, and then maybe even some radiating pain going down into the scapular region or down the arms. Okay? So what we're going to have Lauren do is try to correct this posture. So a couple things that we can try at home are putting a small towel roll in the small of the back, especially if your chair is not ergonomically correct. That's going to push her forward and naturally kind of straighten her up a little bit. That gives us a stable base for the cervical spine to sit on. Next, and I'm going to give her a little pressure here on the top of the mandible, we're going to give a little pressure back and keeping the chin level. That keeps her up nice and straight and takes a significant amount of load off the muscle tissue back here and then these joints up in here. So if Lauren were a chronic postural case, what we might do is give her some postural corrections like this, and then have her go ahead and start hands just on the outside of the nose, pushing yourself back, working repeatedly into some cervical retraction. The first couple of these may be stiff, and it should feel like things actually start to loosen up. And if you find yourself falling into posture like that, this may be a good exercise for you to try intermittently throughout the workday, maybe every 15 minutes, every half an hour, every hour, depending on how much you need to actually dose that to get some relief or to cue yourself to correct that posture. Okay? So let's say that that's really stiff and painful for Lauren because we were too late in our intervention and she's been in that posture for quite a long time. Or if it put a lot of pressure on these muscles back through here. A modification we can make is actually putting her flat on her back, and we're going to have her transition up to this table. And at home you can do this with a bed. And we're going to put a towel roll under the base of the skull. So we don't want this down in the neck. We actually want that space there. Okay? We don't want to use pillows because a lot of times pillows get stuck underneath the shoulders. So we're going to use that towel roll to keep her head right there. And it creates a little bit of space underneath the neck. Shoulders are going to be able to drop down and relax. And we're going to have her just gently tuck the chin. So rather than doing this in a stacked posture, we're doing this kind of in a neutral posture where the neck, the muscles, and the joints are a little bit more decompressed. And then relax, and then tuck down again. And relax, tuck down again. And again, the indication for this is that seated position was just a little bit symptomatic or a little bit uncomfortable and you didn't feel like completing that. So we can try this supine. When supine becomes better and you can try it again seated, if that's less symptomatic, then that's the way to go, is to complete that in that stacked posture, and that makes it more functional to be able to be done at work, in the car, or wherever you need to get some relief and correct your posture. Again, if this is helpful, we're glad. If you need any assistance, give us a call here at McLean County Orthopedics Physical Therapy and we'll help you out.